I want to first of all thank everybody who came to this policy consortium. I think we had a really rich discussion with a lot of incredible themes that came out, and a lot of things that that certainly will inform our thinking as we go forward and look at these results beyond preliminary results with the project we're doing with Vince Bonham, and then also Rachel's project, Rachel Gobb's project, on looking at genomic medicine. And I just wanted to close with a couple of thoughts and a couple of ways that I've been thinking that there's a couple of themes that have come throughout the course of this today. And I have to say, there are so many times where my eyes welled up for so many different reasons. And the reasons were both individual stories, they were societal stories, they were community stories. And we can't forget that there's this whole spectrum that we're looking at. And I remember one of the women who was in Rachel's videos said that she wanted to be treated like a beating heart rather than a sick breast. And I think that is one of the most powerful statements that we saw. It's also a statement that we all know as patients and caregivers, that we are much more than the sum of we are much more than the sum of the body parts that happen to be diseased. And we really do have beating hearts, and we really do have something that's very much beyond what our identity as somebody who's diagnosed with in these cases, mostly life-threatening disease. I think one of the themes that you saw throughout the course of today was this intersection of stories and evidence, and how stories build evidence and how evidence help us elicit stories. And it's the hallmark of what we do. It's the hallmark of what everybody in this room does, and it's the hallmark of what we do at Patient Advocate Foundation and National Patient Advocate Foundation, which is really to work at the intersection of touching people and system change and building this evidence. We talked about bridging the gap. It's a gap that absolutely has to be bridged. And we talked about bridging the gap when we look at, and I think Alan brought this up towards the end, when we look at the difference between the patients that Patient Advocate Foundation traditionally serves, who are very under-resourced, low-income, small families, and we look at the people who come into our personalized and genomic care line. We see the difference in the people that come to these lines. And Vince was talking about redefining what was underserved in terms of thinking about genomic medicine. So if we think about people who have insurance, who are traditionally middle-income Americans, and they have these phenomenal and significant barriers to getting genomic medicine. And then we think about the fact that traditionally underserved communities are not even at the table. We have an unacceptable and an egregious situation that we really have to close that gap. And I mean we, by all of us, have to close that gap. And I was thinking about the way that Drew Couillard closed his talk, which is that it's the story of self, it's the story of us, and it's the story of now. And I think that is a wonderful way of thinking about all the work that we're doing going forward, is that it's self, it's us, and it's now. I want us to be at the point when the next time we have our, the promise of genomic medicine is that we can close the gap so that our angels and our case managers and our angels and everybody in the room no longer have to check the obituaries if they haven't spoken to somebody in 2 weeks. I want to thank everybody for coming. I want to thank everybody for engaging in this dialogue and staying throughout this program. And I look forward to working with you as we close this gap between the story of self, the story of us, and working at the story of now. So thank you very much.